Oh, welcome back to our all staff meetings, monthly meetings that we're gonna bring back now that COVID is still here, but not quite as bad as it was. Today we're talking about infection control, because really that's the hot topic. It has been, it still is, and we have lots of things to talk about just to make sure we're all doing the right things at the right time. Included in infection control is the bloodborne pathogen education that we have to give. So we'll talk about that, our precautions, standard precautions, droplet, contact, when do you implement them, what's involved in each one. Understanding how infections go from one person or surface to another person and surface, and what we can do to stop that from moving through. We will do some COVID education, which we've had, but we're gonna just do one more overview of it. And then know your role and what you're doing here at Capitol View to prevent infection and spreading of infection. And there's a few videos in here from the CDC that I put in so that we're clearly getting everything that they're wanting us to see. So you guys will see that. We're gonna do a bloodborne pathogen video first. It has a, here, I'll do it. It has a company involved in it, so pay no attention to that, but the rest of the information is.
The thing that's different about.
Can you see it, or should I turn it on?
Someone near you just cut themselves, and there's blood on the floor. Should you rush over with no concern for exposure to their blood? While it's always good to help in this situation, the quick answer is no. Or at least not until you have proper protection from bloodborne pathogens. Welcome to this training on bloodborne pathogens. While bloodborne pathogens may not sound like a fun subject to talk about, it is an important subject to keep you safe. Bloodborne pathogens are small, pathogenic microorganisms that are carried in the blood and in other potentially infected materials. These microorganisms can put you at risk of diseases such as hepatitis B, HBV, hepatitis C, HCV, and human immunodeficiency virus, HIV. While you may think it won't happen to me, the reality is illness could happen to anyone that puts themselves at risk of bloodborne pathogen exposure. In fact, the Centers for Disease Control, CDC, estimates that every year there are 65 cases of HIV due to occupational exposure, and about 8,700 cases of healthcare workers infected with hepatitis B. At Ronstadt, your health and safety are important to us. That's why in this video, we will provide you with an overview of what you need to know about bloodborne pathogens to keep yourself and those around you safe. In alignment with the federal OSHA bloodborne pathogen standard, we will equip you with information about blood and other potentially infectious materials, types of bloodborne pathogens, ways to reduce risk of exposure, including personal protective equipment and vaccinations, and what to do in the event of an exposure. Pay close attention. Remember, when it comes to bloodborne pathogens, your health and safety is at risk, and no one wants to get sick. Let's talk a little more about these pathogens. More than 12 million Americans are infected with hepatitis B, and the virus can last up to a week in dried blood. Signs of infection include jaundice, fatigue, abdominal pain, and loss of appetite. Hepatitis C has similar symptoms. Exposure to either hepatitis B or hepatitis C lead to chronic liver disease, liver cancer, and even death. Hepatitis C is the most chronic bloodborne pathogen infection in the US. HIV is the virus that leads to AIDS. There are about 1.1 million people living with HIV. Once you are infected for life. So the risks are real. And while hepatitis B, hepatitis C, and HIV are most commonly talked about, there are many other types of bloodborne pathogens, such as malaria, brucellosis, syphilis, and the West Nile virus. All of these pathogenic microorganisms can be found in infected blood, as well as other potentially infectious materials, OPIM, such as blood products like plasma or serum, saliva, semen, vaginal secretions, skin tissue, or other bodily fluids contaminated with blood. Unless visibly contaminated by blood, Many bodily fluids, such as vomit, tears, sweat, and nasal secretions, are typically not infectious sources of bloodborne pathogens. However, it is best to treat all bodily fluids as potentially dangerous. The reality is, you just never know. Bloodborne pathogens are transmitted when infectious blood or infected material is introduced to the bloodstream of a person. Take a moment to think about your work environment and how you might be exposed. Let me share with you some examples. You pick up contaminated materials without gloves, and you have a cut or a hangnail on your finger. Non-intact skin is a common route of transmission. Other examples of non-intact skin are acne, scratches, cuts, bites, or blisters. Or, you used gloves to pick up an exposed object, but then, with your contaminated gloves, you touch your eyes, nose, or mouth. Exposure can take place through these mucous membranes. Or, a contaminated needle or sharp object is laying on a table. You pick it up and prick yourself. Pricks or cuts with sharps are a common route of exposure. Don't let these situations happen to you. Recognize the risks of bloodborne pathogens occurring through direct contact, indirect contact, and respiratory transmission. The risk of bloodborne pathogens exists in every work environment. The risk is even higher when working in a healthcare or lab setting because there is greater potential of coming in contact with blood or other potentially infectious materials. So, be sure to take proper precautions, such as wearing personal protective equipment, PPE. Examples of PPE that can reduce risk of exposure include gloves, masks, aprons, smocks, gowns, mouthpieces, safety glasses, and CPR post masks. Risk can also be reduced by obtaining the hepatitis B vaccine. Randstad, as well as our clients, have exposure control plans in place. It is important for you to observe standard precautions and treat all blood and bodily fluids as if contaminated. When cleaning an area that may be exposed, do not pick up broken glass or other sharp objects by hand. Additionally, always use an appropriate disinfectant to clean the infected area. Thoroughly wipe down all infected surfaces and wash up after exposure. And be sure to dispose of potentially infected waste in the designated biohazard labeled bags or sharps containers. Exposed materials should never go in the regular trash. Now, let's talk about what to do if you think you've been exposed. Assume you pick up a sharp object and prick your finger. Yikes. What should you do? The first step is to wash the exposed area with soap and water. Then report the situation to your client supervisor, as well as Randstad, immediately. They will guide you in the process of determining if immediate medical attention is required. Take the same precautions if a potentially contaminated splatter hits your face. Be sure to flush your nose, mouth, and skin with water, and irrigate eyes with water and saline. And again, always report the situation immediately. Here's the bottom line. At Randstad, we value your health and safety. We also expect that every Randstad team member takes personal accountability for their own.
Yeah, okay. We don't have to listen about their company, but similar here, because we do have exposure folders up at the front desk that guide you through what to do. So there's red folders at the hug station. In the drawer, it will tell you the number to call, right? It's a nurse line or something they want you to call. But number one, you're gonna flush the area for 5 to 10 minutes. Then you're gonna go there and you're gonna follow the directions. They will guide you on if they think you need to go to the emergency room or not. Well, I got ahead of myself. I'll show you the form in just a second, okay? But basically with bloodborne pathogens, you really need to know your risk when you go in the room and you protect yourself against those risks. So depending on what you're doing with the patient, if you're just going in there to sign papers or help them up or whatever, that's different. If you're gonna go in there and do treatments, catheter cares and that type of stuff, you need to make sure that you're protecting yourself. So the proper PPE, if we get patients with HIV or hepatitis, they really are just standard precautions, because the only way you're gonna catch anything is if you're doing a procedure where something's gonna get into your cut, but the procedures you're doing require gloves and a gown and that type of stuff. So you won't, and we shouldn't put them in contact because they're in it. But you guys are gonna need to know, as you care for everybody that you're doing those cares with, you should be wearing the PPE that you need. So treat everybody like they might have it, so standard precautions would tell us to do that too. I'm sure we've had people here with hepatitis and HIV that we don't know, because they don't know. Because it takes sometimes years for symptoms to arise, they have it, but the damage hasn't been done, so it's not showing. So no one's tested them for it. So you just need to make sure when you're caring for everybody, you're doing all the right things to protect yourself. And then here's where we're talking. So wash the area if you're exposed. I'll show you the next form, but normally we do go to the emergency room and they advise us. The form we'll look at, you bring the form to the emergency room with you. You have to keep the original. You have to bring that back with you because Julie needs the original form. So don't ever leave it there. They can take a copy if they need it, but you need the original. And that CDC recommends you go down to the emergency room within a couple of hours. So if something happens here at work and you flush it and you call and they want you to go down and you think you can't leave up here, I mean, call us. If we're here, we should be knowing about it. If I'm at home, I should know about it. If I need to come in or someone, we have to try to find somebody to come in and cover your people, then we need to do that. So you can go downstairs. These are the forms in the red folder, and you can just follow them. The number is right up there for exposures, 8835484, but you'll see it when you come through. So completely fill this out, take it with you downstairs, because they will need to look at it and write anything on there that they are thinking you need to do. So personal protective equipment, they talked about that. Obviously we have gloves and gowns and masks. The respirators are the N95s or the PAPRs. We don't have any PAPRs here yet. If somebody goes through and doesn't fit in a respirator, gets sent to occupational health, they will do another assessment with you. If somebody's determined to need a respirator or a PAPR, then we'll have to try to figure out how to get one. The hospital has a system where you check them out, check them back in when you're done. I have to look into that type of thing because I don't think we're gonna need a lot. It would just be probably one or two if we do, but at this point, no one's told me they're needing that. We do have some goggles that make you look like a minion if you need them. Otherwise, the glasses with the tops and the sides covered, and the face shields, we have those as well. Materials has them downstairs, so if you guys are like, I don't see any shields, there are some in my office. But if you need them, you can call down and they will bring some up, along with glasses. All right, the different isolation precautions, everybody should be in standard, we talked about that. Contact, droplet, and airborne, for us just go hand in hand, okay? Standard, obviously hand hygiene falls into all of this. Wear the PPE that you need, depending on what you're doing. Patient equipment, when we're going in and out of rooms, we need to make sure we're wiping off oximeters, but it's not like going into a true isolation room where you're washing off the pole or you're washing off all your stuff when you're coming in and out. If we're giving shots, obviously, safety practices with that, environmental cleaning, housekeeping has a schedule where they're doing the rooms, respiratory hygiene, coughing. We've got our masks on all the time. That's probably more important without masks. Handling of laundry, making sure we're bagging it and putting it into the hamper. COVID or any of those isolations, as long as you bag them in the room, they all go into the regular laundry. And then I think that says room placement. Is that what that's something about? Yeah. So, Kelly's pretty good at putting people, like if they have the same infections, they can go together. Otherwise, they're in privates. And COVID people can go together as well. But then we have to look at when somebody's out of isolation and how long the person has to be and such. Contact precaution is gonna be a known infection. So if it's MRSA, C. diff, something like that, where we know the person has it, then they get the magnet, the green magnet, the isolation card, all that stuff goes outside their room. So it could live in urine, stool, wounds, blood and body fluids, pink eye shingles, all that kind of stuff. But MRSA, VRE, those are the big ones that we see. Sometimes it's ESBL, but C. diff is the biggie. the norovirus. We haven't had that here, thank God. Knock on wood. Soap and water for hand washing with C. diff. The other ones are okay with, the alcohol. Any kind of skin infections, if we can cover them, if they have areas and we can cover them, that helps. So they don't become airborne. Chickenpox is airborne as well, if they blister and they open. So if we can cover those, if that's something that we can look at, if we have that. If you have wound infections with a lot of drainage, to be careful and mindful of that. And then pink eye falls into this too. Transmitted from direct or indirect contact, so touching things. So C. diff, it has spores, the spores are airborne, they land. So when you're in a room touching the table or the phone or the side rails or the chair, anything like that, they can be living there, so you have to be careful. Think of what that patient might be touching too, and they have it on their hands. So before they leave the room ever, they should wash their hands in the sink before they come out for therapy or an appointment or whatever they may need to come out for. Always wear a gown, gloves, for sure with contact. Our masks are never ending, so they're on all the time at this point. But obviously a private room. Droplet. So there's a whole list over here on the side about droplet. I feel like right now it's contact. I mean, when we're in a contact, we're all droplet, right? Everybody's droplet right now because we're in mass all the time. If we were ever to lose these are the patients we'd have to put them back on for. I don't even know. Did COVID make its way onto my list? Probably not. That should be the first one, this one. Anyways, MRSA and the NARS is usually what we'd see the most of prior to COVID. Okay, expelled by the patient during sneezing, coughing, talking. The droplets are larger, travel less of a distance, 3 feet, but can transfer to people through eyes, nose, and mouth. So we have to be, obviously, with our masks on, a surgical mask. COVID is the N95 if they do indeed have it. They have to wear surgical masks if they leave the room, but we're doing that now for COVID risk, or anybody right now at this point, aren't they? Their doors can stay open. If they are over here and your droplets carry 3 feet, the door can be open because they're not traveling out of the room type of thing. And no special ventilation, and we don't have special ventilation here, so they can stay. Hand hygiene's huge for them to be leaving the room as well. Face masks, N95 masks, eye protection, face shields or goggles, gowns, gloves. The door needs to be closed with COVID patients. And you'll see the designated information on the door. The one thing we have to remember as we put those sheets on the doors, there is an order to putting PPE on. The surveyors watch that stuff when they come around, so we need to make sure that we're doing things in the right order. This is hard. Not exactly sure how we can accomplish that when unless you're all in the room as you take it. Well, we are all in the room, but you'd have to stand by the sink and slowly take things off, and you wouldn't take that off till you were out the door. We put them outside the door. So, this is the way they want us to do it, so we're gonna have to just,
Lots of alcohol.
yeah.
The hand
By the
sanitizer
door.
is the preferred,
Yeah.
for COVID, because it actually kills COVID better than hand soap and washing.
So right by our exit is our foam.
Our foam
So
in,
as you're doing it, taking your stuff off by the door, there should be a hamper right by the door for your gowns as you're taking them off before you escape the room. Okay, 2 more. This is so you don't get sick of me talking. I need my little computer gal over there to see if that works. And this lady's in all of them, so you just gotta tolerate her.
and she's just so much
She'll
fun to
introduce
watch.
herself multiple times.
Hi everyone, and welcome back to Inside Infection Control, our video series here at CDC's Project First Line. I'm Abby Carlson. It's great to have you here today. Today we are going to talk about COVID-19 and the eyes. You've probably seen that eye protection, either goggles or a face shield, is part of the PPE recommended for COVID-19. But why is that? What do the eyes have to do with anything about this? We focus most of the time on protecting our nose and mouth because we think about the virus getting into those target zones of the nose, the mouth, the back of the throat, and the lungs, and then infecting us. But eye protection is needed because the eyes are another way that COVID-19 can get into those places and make you sick. With eye protection, the first thing you might consider is, oh, we're thinking about splashes and sprays of blood or body fluids that might land in the eye. And that's true, that's definitely a consideration. But for COVID-19, we also want to protect our eyes from respiratory droplets because we know those droplets can carry virus and they can get into our bodies through our eyes and infect us. So again, they can reach those target zones in the nose, mouth, and back of the throat through the eyes. How does that happen? What's the connection? Okay, so imagine somebody's coughing at you or even talking at you and some of these little droplets are coming out and they're aimed towards the eye. Well, where do they go? Your eye, in its anatomy, has a thin, delicate tissue called the conjunctiva, and it covers the inside of your eyelids and part of your eyeball itself. And that is a mucous membrane, so it's like you have inside of your nose and your mouth and other areas of your body. And its job is to keep the eyes nice and protected, and it needs to be hydrated to do that. And so it protects both the membrane and the eye itself. That conjunctiva is covered by a liquid, okay? That liquid are essentially your tears. And that protects your eye and keeps them healthy, making sure they're working correctly. But your tears aren't just salty water. They're actually part of your body's natural defenses, your immune system. They contain chemicals and antibodies that help protect your eye from things that get into your eye, like germs like bacteria, funguses, even viruses. Your tears do a really great job of protecting your eye most of the time, but some things, like COVID-19, can get into the eye and cause problems, and that's why we need an extra layer of protection with a goggle or a face shield. Okay, so that liquid, all this liquid is being produced to keep your eye nice and hydrated, nice and wet, but where does it go? Because it's being made every single day. Well, it travels through your tear ducts. So your tear ducts sit right here at the corners of your eyes by the bridge of your nose, and you can see them if you look in the mirror. You'll see a little pinpoint dot where they open up, and they connect your eyes to the nose and the back of your throat. There's actually a little drain that travels in there. And all that liquid that your eyes are making goes down that drain and gets drained out through the back of the throat. This happens every single day and is a normal process. And you can think about it, when you think about yourself crying, right? You know that your nose runs. Well, some of that is because some of that water that you're producing when you get tears is traveling down those tear ducts, down that drain into your nose, and you have your nose, comes out the front, it runs, that's your tears draining out. All right, so the things that land in your eyes, like these respiratory droplets we talked about with virus in them, they can hit this eye system, they mix with the liquid in the eyes, they travel down those drains and into the nose and the back of the throat. When the virus gets those places, the nose, the throat, the mouth, it can find cells that it can hack into and cause infection, and that will make you sick. Now, not only that, but it can also infect the eye directly. So we're learning more and more about this, but we found that there are cells within the eye that the virus can also hijack, can get into, and cause infection. They're certainly not the only virus that can do this. One that's really familiar to everybody is pink eye, where you get a nice red, inflamed eye, it's itchy, it hurts. That's caused by a virus, and it's the same thing. It hijacks into a cell and causes infection. COVID-19 doesn't cause those same symptoms. It doesn't make you feel the same way, but it still can get in those cells, it still can make you sick. So we worry about that too. All right, so it makes sense with all of that we would want to protect our eyes on top of protecting our nose, our mouth, and our throat when we think about it this way, when we think about respiratory droplets. At the same time, while we're protecting our eyes, just a quick note, you want to make sure that you can still see correctly. So however you choose to protect your eyes, make sure that you're still able to do your work and see what's going on. We'll talk more about other PPE in future episodes. We're also going to have some additional pictures and tools for you on our
See, that's round one with her.
CDC's Project First Line. I'm Abby Carlson. I'm an infectious diseases doctor at the CDC, and it's great to have you here today. You may have noticed that a lot of the infection control recommendations for COVID-19 apply all the time, not just when you're caring for a patient that you know has COVID-19 or that you think might have COVID-19. Why is that? Why are steps like source control important all the time? It's because we know that many people who are infected with SARS-CoV-2, the virus that causes COVID-19, don't actually know it because they aren't feeling any symptoms. They don't have fever, cough, shortness of breath, or other signs of disease. And even though they don't look or feel sick, they can still spread virus to other people. How does that work? On an earlier episode of our video blog, we talked about how viruses make you sick. When you feel sick, like with a fever and your cough, that's your immune system that's kicking in to fight the virus. You can check that episode out for more details. We've put a link to it as well in the comments, so if you want more information on that, follow up there. But what's important to remember is that you can be infected with the virus and your immune system can still be working, but you might not feel sick. You may have been infected recently and you haven't started feeling sick yet, but you're going to in a couple of days. That is called pre-symptomatic infection. Or you may be infected and you will never feel symptoms at all. That is called asymptomatic infection. It's not clear why some people have milder cases of COVID-19 than others, or why some people are infected with SARS-CoV-2 and never show any symptoms. But either way, when you're in this state of having the virus but not feeling sick, you still can spread that virus to other people and make them sick. How? Well, the virus in your body is there making copies of itself in your cells and spreading around. So it's in your respiratory droplets. And those droplets come out filled with virus when you breathe, talk, cough, or otherwise push them out of your mouth and nose, like when you're yelling or you're singing or exercising hard. And those respiratory droplets will spread places. They can be breathed in by others, and then the virus can start attacking that person's cells, or they can fall on surfaces where they can be picked up and spread that way. Just one thing to note, although we're talking about COVID-19, it definitely is not the only disease that spreads from people who are infected but aren't showing any symptoms. Another really common one in healthcare is influenza or flu, and it's a problem every year. So to sum it up, what's important is to keep doing the recommended infection control actions, like masking for source control, to keep that virus from spreading, even if you don't know if you have the virus, and even if you aren't feeling sick. That way you're still protecting other people by having a mask on.
And wearing glasses. So that was our recent big change again, is putting the glasses back on. So that was the health department wanting us to still be wearing them, and that is why. So from that, Michelle and I were checking the website for county numbers. We do it every week. It's a confusing process. Now we've got it figured out now, and we are high numbers still, even though you don't hear about them.
We did receive one deficiency on their last visit, and it was pertaining to the goggles because there's an interpretation to change a setting on the CDC website, and then you're supposed to only read the map and no longer read the verbiage on what the county is. Unfortunately, Tracy and I were still just reading the verbiage and not monitoring the map, because on one of their trainings that they had a couple months ago, they said that the map isn't always updated and that we should read the verbiage. So it's a moving target, and I am fighting that deficiency, and I will be going to IIDR, but in the meantime, we need to wear goggles at all times. because they're still thinking that it's very high in, Ramsey County.
The whole state
Yeah.
was red.
Well, that was
Still.
one, I think that was Pipestone, Minnesota.
That was maybe yellow.
Yeah, Pipestone County was
Yeah.
yellow. So, if you're in Pipestone, take off your goggles.
Yeah, right. And then just know that I have to audit. So you'll see me a couple of times a week just tootling around with my board, making sure people are wearing their glasses, goggles, face shield, and then I'll just have you sign off. If you're not wearing it, it's a conversation that we have, just a reminder to put it on, a little re-education, and then we sign it, and I just say that we re-educated. But it'll be an ongoing thing, so if you see me running around, be ready to sign a piece of paper.
So it's not just, in patient's room, it's all the time?
No,
So like
it's-
right now?
It's
Yeah,
in
like when
patient,
you,
it's
it's in the radials, like in the patient care area.
in patient care areas.
Oh, okay, gotcha.
So, in your radial, the patients don't come in there, but if a patient were to come in there, you really should put your goggles
Yeah.
on. Does that help provide clarity?
Yeah.
I know that one question that somebody asked you was, how come we wear them here but not in the hospital?
That's a really great question.
Yeah.
So, the only thing I can say is that,
They should be wearing.
they should be wearing them. By the clarification that we got, and I
From
shared that
this week,
clarification to my boss, who is one of the VPs at the hospital, but, how they want to interpret it and how the Department of Health are, they were interpreting it exactly like we were. We got a citation, we were corrected on what they expect us to be, so we are going to follow their direction, and it's not our job to worry about them. Our job is to worry about us, so,
So we need to wear.
that's all I can say.
And I will say, well, and I said that earlier though, that materials has them. I can't find good ones that go over glasses. Yours are fitting over your glasses. Do they
Yeah, but
fit?
she has small.
I have
Yeah, I
small
know,
glasses,
so it's different.
Mine work too.
Yeah, I know you can order some, I know we got some at the beginning, I'm not sure.
See, and I wear
all
oversized
went.
glasses, and so then I can't find goggles that go over mine. I have to either wear a shield or else I just have to take them. These are just reading, I have to take them off. So.
But you gotta be able to see.
Well, normally
Like
I
she
don't,
said, you gotta be able to
normally
see
I'm
what
not
you're doing.
reading with the patients,
I know.
normally I'm listening to a complaint, and I'm yelling at me.
Well, that's true.
That's usually when I'm in there. Or you've told me that they won't take the meds and they're gonna hit someone, so then you send me in, so that's usually what it is.
Yeah, oh my gosh. All right, so we will continue to do that until, well, who knows, maybe forever. If the patients haven't been vaccinated, they need to be in a 10 to 14-day quarantine. Just on the last, monthly meeting that they had, they talked about it being 10 instead of 14. I am looking into that, I'm not changing it unless I know for sure, cause I'm not gonna get in trouble for changing something that they are wishy-washy on. So, we're looking at it.
Because we changed the goggles and then they came
Yeah.
in and gave us the deficiency.
So, I believe their new thing is if you're checking them twice between day 1 and 7, if they're negative at 7, you could probably remove them at 10, is kind of what they said. But I gotta do a little digging. But we'll make sure it says it on the door, if it's 14 or 10 or whatever it is, we'll make sure the dates are on the door. All patients can have visitors regardless of their vaccine status or if they have COVID, they can have visitors then. If you do have people that come, if we're here, find me, Dave, we can help educate them. They can go in, they have to wear everything, they need to stay 6 feet away, but they also need to know their risk to get it. So as long as they're understanding that and still wanna go in, we need to let them do that. And everybody has to be fitted for an N95, so you cannot go into a patient room, either in quarantine or COVID, without one. So if you're not fitted, I have the number, you guys need to get fitted, there's not too many left that aren't. And then if you need to go to occupational health, let me know, cause then I need to follow up with them. When you are fitted, let me know, like you brought me your thing. There's some new Honeywell masks, if people aren't fitting in 3M, they're now fitting into Honeywell masks, cause that, we're not stocking all the time, cause there's not that many of them. But Sarah's been ordering them and they're in her office, 2 or 3 different Honeywell kinds,
Yep.
right? So that's where you're gonna find yours
Okay.
if you need it. Okay. Oh, yeah. Make sure if you're the admitting nurse, if you guys know somebody's in isolation, we get everything in place, cause nobody should go in there without seeing a magnet, without seeing the cart, without knowing that when you're going in. It should be on the admission sheet. You should be able to get everything set up before the patient even comes, okay? We have a little bit on the flu, been very minimal the last 2 years, cause we're all wearing masks. A little bit of an uptick this year, cause people weren't all wearing them in the community, but by and large, not much happening. When we have weekly updates, we're in that area, I send them out, so you guys kinda know schools, facilities, like what's happening with the flu. It's an October to April or May type of thing that we look, it seems to go a little longer than April. But make sure that we're, reporting symptoms. I mean, right now, we just think COVID, if somebody has symptoms, and we're out of the flu season, so that makes sense. When we're in the flu season, it should be either one that we're looking at. Hi, Jenny. All right, C. diff. No. Bacteria that causes diarrhea and possibly life-threatening inflammation of the colon. So, it's kind of people that have been in the hospital and older people that have, are at the highest risk. People that have had antibiotics are at the highest risk. So, this goes back to 2011. That's 10 years ago. I would be curious to what the number is now. But 29,000 died within 30 days of the initial diagnosis. Because if you can't stop and slow it down, it's going to deplete everything and make them super sick. But it's usually the older people that are getting it. Watery diarrhea, at least 3 bowel movements a day for 2 or more days is what we look at when we're looking at sending a sample down. They can have a fever, loss of appetite, cramping, abdominal pain, nausea. We talked about it earlier, it's shed in spores, okay? So surface, toilets, bathtubs, we don't use electronic rectal thermometers, but things that can be contaminated with feces is where the C. diff is living. So make sure they're transferred to patients mainly from hands of healthcare workers or equipment, I would say. If we're using lifts, vital signs towers that go in and out, anything that's going in that room with that patient, commodes for sure, so make sure you're wearing gloves all the time when you're in there. A gown, if you're gonna touch anything that they've been touching, for sure. So what do you do if you think your patient has C. diff? Let's see, make sure they have dedicated equipment in there. You don't wanna keep wheeling your tower in and out and using the blood pressure stuff, cuff on them. Send your stool sample. If you can't get a hold of the NP, just put an order in and send a sample. If you can quickly peek in the chart and make sure this isn't because we just gave them 10 doses of Miralax and some Megcitrate and, like, make sure we didn't give them a whole bunch to go and make them have diarrhea, because that is not necessary to send. But if it comes up all of a sudden where they're running. Communicate with a coworker, so make sure everybody knows, okay, if you go in that room, this person's had these loose stools, make sure you're doing it in a report to let therapy know so that they can kind of be mindful that they might have it. They should move to a private if we know they haven't, okay? If they share a room and you can't move them because we don't have any room to move them, have the roommate use a commode if you can, because having that person with loose stools go on a commode and then you're gonna go and dump it and spray it and like where that's going, I'd rather not. It would be best if that patient could use the toilet. And then, we'll have to have the conversation with the roommate, just for your safety right now, and have that conversation, and we can do that if you need us to. Make sure you're wearing gloves and a gown when you're in the room working with them, and it's hand washing with soap and water and bleach on the surfaces. So you always know when housekeeping's cleaned a C. diff room because you can smell it everywhere because of the bleach.
That patient will not have the time to reach the toilet.
The what?
The patient will not have the time to reach the toilet.
If they can't get there?
Yeah. Maybe all
Well, then you're gonna be wearing all sorts of things
Yeah.
and you're gonna have to wipe that
Yeah.
surface.
yeah.
Like, if you're in the bathroom and you're emptying it and spraying it and all that, you're gonna be wiping everything down in there every time you do it. How long do we isolate? So for a minimum of 48 hours after the diarrhea is resolved. So that's the first thing, like, are they still having loose stools? Is it formed? That type of question that we're asking. We should have them for the duration of the antibiotic, so we'll kind of look at both of those things. We clean the room, but we do have to do the bleach in the room. The robot, I don't know what else to call it from Regents.
No,
Little
it's a
guy.
robot.
It's a robot. After we've cleaned it and it's kind of been set up with the window or the pillows on the ledge and all that kind of stuff, then their little robot has to come up and clean it before we can use it on another patient. Make sure we're cleaning from cleanest to dirtiest, so the bathroom's always last when we clean. And daily, cleaning for high touch, so the things we're touching the most of are the most important parts for daily. Well, there's more! Yay! Okay, hold on a minute, quick. I can't remember what they are. Whew. It's the same lady.
Hello everyone, I'm Abby Carlson. Doctor here at the Centers for Disease Control and Prevention in Atlanta, Georgia. And welcome to Project First Line's new video blog. On this blog, we are going to be explaining some of the basic ideas behind infection control, why they work for COVID-19, and then how they work to protect you and your patients, your coworkers, and your community. To start off with a little bit about myself, up until a few months ago, I, like many of you, was working in a hospital. I was part of an infection control team, and I was also working as a doctor, caring for patients. And as you know, it's been almost a year now since the beginning of this pandemic. For those of us in healthcare, it has been a year filled with a lot of change and a lot of challenges. We've encountered situations that were seemingly impossible. They were new, they were stressful, and quite frankly, they were scary and traumatic. We're doing so many things differently now because of COVID-19, from screening patients and employees at the entrances to wearing masks all the time when we're at work. These changes can be overwhelming to all of us. And we may not always understand why we're doing certain things that we're doing or why those things matter for stopping the spread of the pandemic. Let's be honest, there are a lot of infection control recommendations for COVID-19. There is a lot to do, and it is really important that we do it right. We here at Project First Line are here to help with that. We want you to understand not just what you're doing to control COVID-19, but really why you're doing it. That's because we believe that you can do your job best when you understand why you're doing what you're doing. So, before we get into the why, it helps to first think about what we're trying to do with infection control. The ultimate goal of everything we do in infection control for any disease is to keep people from getting sick. In this case, to keep people from getting sick with COVID-19. Obviously, we don't want our patients to get sick when they come to see us for care, but it's equally as important that they don't make us sick as we're providing care. And, just as importantly, we don't want to make our colleagues and coworkers sick as we work together. We want this to be a safe process for all. We're in healthcare because we want to help people. That job is more important now than ever. And we all recognize that there's some risk of infection in going to work during a pandemic. So the goal of CDC's infection control recommendations is to protect you and everyone in the healthcare facility from getting infected while you're making sure your patients have the essential care that they need. And our goal here at Project First Line is to make sure that you have the infection control knowledge that you need and deserve to keep yourself, your patients, your colleagues, and your community safe. In our next video, we're gonna...
So I want you guys to know, like, if there is anything that you wanna know about this, she's got like 30 of these things. So if there's something like, you know what, why do we do this? Or how can I, you know, like, you can go on YouTube and just search it up. There's a million on there, I just picked a few.
And there's another great one coming our way right now.
Target.
Oh, it's her.
You gotta learn to like her.
Welcome back everyone to our video blog here at CDC's Project First Line, Inside Infection Control. I'm Abby Carlson, I'm an infectious diseases doctor at the CDC, and it's great to have you back with us today. We have talked in earlier episodes about cleaning and disinfection, what each of those do and why they're so important in healthcare. You'll remember that cleaning removes dirt and gunk and some germs that are on surfaces, and disinfection comes after cleaning and kills those germs. Today we're going to focus on disinfection and specifically about something called contact time, what it is and why it's so important. Contact time, and you're also going to hear this called dwell time or wet time. It's the amount of time that a disinfectant needs to sit on a surface before being wiped away or otherwise disturbed in order for it to do its job. And its job, as we know, is to kill the germs. There are a lot of germs in healthcare, that's no surprise to any of us, and quite obviously we don't want them to spread around to our patients or to others. When we disinfect surfaces like bed rails and door handles, or when we disinfect equipment like stethoscopes and other devices, all of that is a huge part of infection control. And that's why it's important to disinfect correctly. Now, in the United States, we rely on the Environmental Protection Agency, the EPA, to review the chemicals that are used in the workplace to make sure that they're safe. Disinfectants used in healthcare should be registered with the EPA, and the label usually says something like hospital grade, which identifies that product as being what that can be used in the healthcare setting. We've put a link below to one of the EPA's specific lists, List N for November, which is the list of disinfectants that are effective against SARS-CoV-2, our virus that causes COVID-19. Now, when you're using a disinfectant, it's incredibly important to follow the instructions on the label. And there are a lot of reasons to do that. You have to know what the chemical can be used on, which surfaces it can be used on before you use it. You have to know which germs it's been proven to kill so that you're using it in the right place at the right time. And you need to know if it needs to be diluted, which means adding water to it to take the concentration down to a safe concentration and a correct concentration for killing germs. It's a little bit like cooking, and you want to use the right ingredients and follow the recipe. But one of the most important reasons for following the label instructions is to know the contact time. The product that you're using might not kill germs right away. It actually takes time for germs to react with the chemical in the product and get that killing effect on the germs before we can say that something is truly disinfected. Depending on the product, the germ that you're targeting, this time can vary, but it's always specific and it should be on that label. If you're using a product that both cleans and disinfects, it's still going to have the contact time that you need to know.
I've had enough of her. You guys? So for us, it's 2 minutes with the products that we have. Uh-oh, I lost my link.
That's all right, I got you.
Good job. But a lot of that takes place in here. So when we talk about the chain of infection, we're talking about you have a bacteria or a virus. It's living, right? In a warm, moist area, probably. In order to pass it on to somebody else, it has to have a way out. So if it's respiratory, then we're coughing and we're sneezing. If it's in the urine or feces or a wound, it has to have a way to get out. But then you're talking about how is it transferring to somebody else, right? Are we ingesting it? Are we touching a cup that they've touched and then going and touching something else in another room without washing our hands? Once we move it, then how does it get into the next person? Once it gets into that person, are they a good host for it? Our patients are good hosts. Most of us are not good hosts, which is why we don't end up with the bulk of the things happening. because they have, they've been in the ICU, they've been through surgery. Their defenses are down when they're here with us, so they're more at risk. So when you look at this type of thing, anywhere in here, if you're disinfecting everything, if you're washing your hands, wearing your equipment, then it's not gonna move to that next person because you've controlled it here. Same thing, hand washing, PPE, cleaning, isolation if you know somebody has it. So when they talk about breaking the chain, hand hygiene pops up in every single one. PPE pops up, and then cleaning surfaces. So making sure that when we are wiping things off, you let it sit for 2 minutes before you're doing anything else to it. So there's a question on your quiz about this, just so you know. Everybody gets a quiz. So we just kind of went through this, but this is what they're talking about with, you know, how infections go from one person to the next, and what do we do to prevent that from happening. These are no-nos. If you guys see anything like this, please, you don't have to take pictures. But I've seen, you know, some of our isolation rooms, you can't shut that little thing anymore. Once it gets to the top, we just need to bag it, start a new one, and throw that in the laundry. This room that we're throwing down the linens in should never have overfilled. If you're ever in the radial and the lids don't close on these, they immediately need to go. They can't sit open like that, so just know that. And I have no idea what was happening over there with a towel under a sign. We should have a fan or something drying it off. Okay, so hand washing, hugely important, right? That's like the main thing here that we can do besides wearing our PPE and that, so that we're not moving things around. Half of healthcare workers clean their hands as often as they should. Make sure the patients and visitors are too. So when you do see visitors coming and going, it's okay before, if you're in a room with them, just say, you know, remember to wash your hands before you leave. For sure if they're in isolation. But it's okay to remind people to do that. So the last thing, I think, is this video, if you wanna put up, there's a good one. You wanna take the quiz instead? Okay.
Go to the next, are you done?
Well, it's just hand hygiene.
Well, let's just talk through it instead of watching the video.
Well, I kinda like the video. Might get rid of the last video. Let's watch the next one. Well, and this is just really how often, and really before you go into the room, when you come out of the room. If you're doing wound care with nursing, you take the dirty off, you take your gloves off, you wash your hands, you put new gloves on. When you're touching patients, when you're at risk, like standard precautions, you're at risk for exposure to something on your hands. Really, after touching their surroundings, we're wearing gloves in every room right now anyways, but yeah, if you don't know that they have C. diff and they've got it, you just don't wanna touch things. And obviously eating, toileting, coughing, sneezing, when you come to work, before you leave work, like.
And remember, when you're doffing, there was 3 times where you needed to do, hand hygiene. In between each step, you're grabbing
Oh,
that
when you're
hand
taking your
glove, so.
PPE.
Cause that's what you're really talking about, is when you're taking off that PPE too.
In your COVID room. 20 seconds.
What song do you guys sing when you actually wash your hands?
Happy birthday twice, cause that's what I tell my students.
Alright, happy birthday twice.
Yep. Yep.
Anyone else got anything?
The alphabet?
The
Oh,
alphabet,
yeah.
yep, that's
That's
the other
good.
one I recommend.
Mhm. And they will watch you, so when
Yep.
they do come, they stand there and watch us wash our hands before we tray pass, but they really do watch everything. And then just so that you guys know, we do have an antibiotic stewardship. Naomi's been running it, I will take it over, but it really is watching every antibiotic that started and what's the duration, is it necessary or not, and it has to do with the providers and tracking, and are they better, and do we need to reculture, and like this whole big thing, but have to do it. Oh, look. Some kind of fun
So,
thing.
I normally, so all the people that have not been to an all staff, I usually started off with the fun stuff, but we didn't get a chance to do it because, well, Tracy had an extensively long PowerPoint today that she had to get through to kind of get us all caught up on infection control and all the policies and changes with COVID and everything to that effect. So, I'm doing an impromptu, a little celebration, so, I get those, notifications when it's someone's anniversary, and there's someone in the room that has a big anniversary, so I thought I'd call them out in a celebration. Cause this person has gone above and beyond to try to keep us, going strong, and helping out on multiple shifts. Emmanuel is celebrating 10 years next month. So we've had 10 years of fabulousness with Emmanuel, and I want to say thank you, Emmanuel, for all your hard work, and I actually want to say all of you, thank you. As you take your test, I just want to let you guys know that Capital View has put together some policies. We all know that we're trying like crazy to recruit people, right? You all know that. So now we're gonna throw some money at you guys too. So if you know anyone out there and you can recruit them and get them here, we're gonna give you money too now. So there's some referral bonuses that we put into place for all of our nurses and nursing assistant positions out there. So if you know anyone, please send them our way. We're looking to hire more fabulous staff like Emmanuel and all of you to join our team. So, any questions, comments, rumor control you want to discuss? So we are gonna do this once a month again. Do you kind of like it? Getting back together? Getting used to it? It is fun. I will try to put more fun into it. Honestly, I told Tracy that we were gonna give out boxes of COVID tests to anyone that are interested. But honestly, if you want a box of COVID tests to take to your family, please let us know.
We have a ton,
We have a ton in our
and they
office.
just keep coming.
Yeah, just let us know. We've got plenty. We'd be more than willing to share. But thank you guys for coming, and wow, way to go, Tracy.
Did I finish? Ooh, great now.
Yeah.
Okay, so I will say, number 2 is a little bit,
You need a
it
pen?
might be a trickery question. Because